Hepatitis C is a viral infection that affects the liver, initially by causing inflammation in the cells, making them not work so well, leakiness and swelling. Then it can lead to scarring or fibrosis, where good tissue is replaced by dead tissue. And if it continues to advance, it can lead to whole liver failure and even liver cancer. It's important to get tested for hepatitis C because if you have it, the earlier we find out, the easier it is to treat you sooner so that we can prevent complications, and also we can cut the spread of hepatitis C. People living with hepatitis C may not even know they have it. They could have contracted it years, decades before they even find out. But it's really important to get tested, find out, and get treated as soon as possible to decrease any complications to your liver. So for hepatitis C, usually the very first test we do is an antibody test. In rare situations, patients who were recently exposed to hepatitis C, they can go to their doctor and actually get an RNA test, a PCR test for hepatitis C. So who should get tested for hepatitis C? Certainly everybody between the ages of 18 and 79 should get tested for hepatitis C at least once. If you have certain other risk factors, you should get tested for hepatitis C more frequently. Such risk factors include people who inject drugs currently or in the past, people who have HIV, people who have any abnormal liver function tests, people who are pregnant, people who have received blood products or transfusions in the past, as well as organ donations, particularly all of these before 1992, people on dialysis, and anyone that really wants to be tested for hepatitis C should be. Early detection of hepatitis C is important to reduce the risk of cirrhosis, liver failure, cancer, and ultimately death. The normal blood test that we use, called a hepatitis C antibody, may not be positive for up to 12 weeks. This is why it's important to tell your doctor about recent exposure, because they can do a PCR test, and that may become positive much sooner, say within a week or two. I encourage all my patients to tell me whether or not they've gotten tested for hepatitis C. And if they can't remember, we will test them no problem. It's important to know, the earlier the better. We can treat it quickly and we can prevent complications to your liver and help you lead a long, healthy life.